Thank you for joining today's call. Your telephone lines have been muted in order to eliminate any background noise into the conference. At the conclusion of the presentation, all participants will have an opportunity to dialogue with the presenters. If you choose to ask a question using the chat feature, please be sure to send your questions to the host and presenter. All questions will be answered at the end of the presentation. I would also like to remind participants that today's call is being recorded. Your hosts for today's conference are Bill West, Joe Clift, and Marjorie Morales from the Division of Practitioner Data Banks, Bureau of Health Professions, Health Resources and Service Administration, U.S. Department of Health and Human Services. The Division of Practitioner Data Banks is responsible for the management of the National Practitioner Data Bank and Healthcare Integrity and Protection Data Bank. As compliance officers, Bill, Joe, and Margie are part of the team involved with initiatives related to the compliance monitoring and technical assistance for the division. Thank you. Mr. West, you may begin.
Thanks, Holly. Good afternoon, everybody, and good morning to those joining us on the West Coast. Our webinar session today will provide a brief overview of the data bank and our reporting requirements. Then we'll take a look at our new schedule of upcoming compliance activities with all of you, our licensing and certification authorities and organizations. Then we will move into a demonstration of some new features available to you when you log into your account through our website. Thank you all so much for taking the time to join us today. I want to mention that I will have some help from colleagues today. As Holly mentioned, Joe Clift will join us when we work through the new schedule and framework, and when we show you some new features available to you on our website, Margie Morales will join us. And we'll have a question and answer session following the slide presentation. I also wanted to mention that the webinar will be available to you, posted on our website, after it is transcribed a week or two from now. Also, following today's presentation, as always, we'd be happy to be in touch with you one-to-one to answer any additional or follow-up questions you may have. In the event that you get disconnected from the webinar, or if you experience technical difficulties, a link to the slide presentation can be accessed in the webinar email you received this morning. Here's an overview of our talk today. The reason we invited you to participate in this webinar is because we are beginning a new compliance process with state licensing and certification authorities to routinely look at your reporting compliance on a 2-year cycle. We will also post the results of these activities differently, and we'll take a look at that a little bit later. And we have taken a number of steps to simplify and automate the process of asking you about those disciplinary actions you may or may not have reported, and working back and forth with you to reconcile those disciplinary actions in question. We'll take a look at how that works a little later as well. Before we get further into the slides, I'm going to spend a minute or two providing a backdrop for our presentation today. The efforts we are undertaking now began in 2010 when our parent agencies, the U.S. Department of Health and Human Services, HHS, and the Health Resources and Services Administration, HRSA, undertook efforts to improve the completeness and accuracy of data reported to the Healthcare Integrity and Protection Data Bank, or HIPDB, and the National Practitioner Data Bank, or NPDB, collectively called the Data Bank. The Secretary of Health and Human Services, for the first time, published a report listing state agencies that failed to meet their reporting requirements under federal law. In brief, the federal regulations require state licensing authorities to submit, within 30 days, adverse licensing and certification actions, as well as negative actions and findings taken against healthcare entities, providers, suppliers, and practitioners. These reportable actions or findings include both final actions and those taken as a result of formal proceedings. As we continue on today, we will touch briefly on the laws and regulations that impact the reporting process for adverse licensure actions. We will overview the actions that need to be reported to the data bank by licensing and certification authorities. And then we will turn our focus to new developments, the new compliance framework and schedule of activities, and new website applications and features that we will be working on with you over the next several months. We will explain about steps we take in the process of data collection, data comparison, and gap data analysis, the reconciliation of discrepancies, data cutoff dates, statuses, and web posting, and remind you how and where you can get technical assistance. First, a few words about us. The Data Bank is part of the Bureau of Health Professions. The Bureau of Health Professions is one of 6 bureaus and 9 offices that make up the Health Resources and Services Administration, or HRSA. HRSA comes under the umbrella of the Department of Health and Human Services. HRSA is the primary federal agency for improving access to health care services for people who are uninsured, isolated, or medically vulnerable, and provides leadership and financial support. Our Bureau's mission is to increase access to health care with a diversity of programs addressing the health care workforce. The Division of Practitioner Data Banks, or just Data Bank, as part of HRSA's Bureau of Health Professions, is committed to the development and operation of cost-effective and efficient systems that offer accurate, reliable, and timely information on practitioners, providers, and suppliers through credentialing, privileging, government and state authorities like all of you. The next few slides explain more about the legislation that led to the NPDB and HIPDB for your reference. The National Practitioner Data Bank serves as a flagging system when practitioners' credentials are reviewed in terms of professional society memberships, medical malpractice, and clinical privileges. The National Practitioner Data Bank was established through the Healthcare Quality Improvement Act of 1986 to act as an information clearinghouse related to the competence and conduct of physicians, dentists, and other healthcare practitioners. With the implementation of Section 1921 of the Social Security Act in March of 2010, the National Practitioner Data Bank, the NPDB, was expanded to collect and disseminate adverse information beyond just the actions on the professional competence and conduct of physicians and dentists. The intent of Section 1921 is to protect beneficiaries participating in the Social Security Act's health care programs, like Medicare and Medicaid, from unfit health care practitioners, and also to improve the anti-fraud provisions of these programs. With access to expanded information, we make a greater potential to improve patient safety and the quality of the health care provided. Section 1921 information is available to hospitals, other healthcare entities, and state licensing boards by the process of querying the data bank. This information benefits hospitals, other healthcare entities, and state licensing boards with pre-employment screening as well as credentialing. HR departments can query the data bank to support their employment decision-making for all licensed healthcare practitioners, for example, physicians, nurses, and a whole variety of other health-related professions. But for those that query the data bank to get accurate information to inform their decision-making, the information must be reported to the data bank timely and correctly. Although private accreditation organizations like the Joint Commission and the National Committee for Quality Assurance report to us as a result of Section 1921, it is state licensing agencies and authorities like you that are responsible by far for the bulk of the reporting to the data bank. The HIPDB was created to help deter fraud and abuse in our healthcare system by collecting and disseminating adverse actions against healthcare practitioners, providers, and suppliers. The Healthcare Integrity and Protection Data Bank, the HIPDB as we call it, was established under the Social Security Act and attached to HIPAA, the Health Insurance Portability and Accountability Act of 1996, with the purpose of deterring fraud and abuse in the healthcare system. Federal and state agencies must report to the data bank, but with the implementation of Section 1921, state licensing boards and authorities are submitting through one process to both the NPDB and the HIPDB without submitting separate reports. Last year, the Affordable Care Act included a provision for the NPDB and the HIPDB to be merged to improve efficiency and reduce duplication. These two databases will most likely be merged this year. And the merge will have no impact whatsoever on reporting or querying and will not change how or what state licensing authorities or boards submit to the data bank. We'll spend a few minutes on this slide now talking some more about reporting to the data bank. We know from our work with you that there's variation from state to state when it comes to how boards regulate particular healthcare practitioners. So to clarify, if the practitioner, provider, supplier is licensed, certified, or otherwise authorized by the state, this includes certifications you may regulate or other authority given to you to regulate or govern the ability of the practitioner to practice their profession. This includes actions against healthcare entities, for example, nursing homes, pharmacies, or home health agencies. Then, the state must report the action it takes against the license, certification, or authorization. So, what are these reporting requirements as they are defined in the regulations? Adverse actions taken as a result of a formal proceeding, formal hearing, or formal or final board action are reportable to the data bank within 30 days. An action is reportable then when it is the result of a formal proceeding or a final action and includes one of the following four characteristics. So first, an adverse action, formal action, including revocation, suspension, reprimand, censure, or probation. Second, any other loss of license or right to apply for or renew a license by operation of law, the voluntary surrender, or non-renewal of the license. This excludes non-payment of fees, retirement, or moving to an inactive status. Third, a dismissal or closure of a formal proceeding because the practitioner surrendered the license or left the jurisdiction. Or finally, four, any publicly available negative action or finding, which includes a healthcare-related administrative fine or citation resulting from a formal proceeding. You may still have the question, do I have to report to both the NPDB and the HIPDB? Agencies that are required to report an action to both data banks only need to submit a single report, and the report will be stored in the appropriate data bank based on the information you submit. Ultimately, you must determine how the data bank's reporting requirements match your board's action. Data bank terminology and your state terminology may vary and occasionally cause confusion. When you need help in this way, the data bank's compliance staff and help desk are available to assist you in understanding and navigating the regulations and reporting requirements. Here's a resource for you to take a look at that may help you with reporting. The top link on the slide is to a reference library on our website. The bottom link takes you to a flow diagram and decision tree to specifically assist you with the reporting process. You will also find other decision trees to guide organizations that report clinical privilege actions, medical malpractice payments, and criminal convictions and civil judgments. And there are lots of other resources for you to check out on this page as well. Now, before we move to the next section of the talk about upcoming compliance activities and new tools, I want to touch briefly on an issue that comes up a lot, and that is who can access this reported information. The detailed report information contained in the data bank is not accessible to the general public, so who can view or query for this information? Well, first, practitioners and entities may perform a self-query. Also, state licensing authorities or boards like you may query, hospitals, and other healthcare entities, or agencies administering federal healthcare programs like Medicaid and Medicare, contractors to those programs, and state agencies administering state healthcare programs, state Medicaid fraud control units, the U.S. Attorney General, Comptroller General, all may access information in the data bank. So, at this point, we've covered the nuts and bolts of what you need to report and who may access this information. Now, let's move on and talk about our current and upcoming compliance activities with you. Our compliance activities began in February of 2010. We looked at two groups initially, agencies that had never reported to the data bank, and a second group where we performed a one-to-one comparison. The first group was called the Never Reported Professions Compliance Effort. For this compliance effort, a list of state agencies and licensing boards responsible for certifying or licensing healthcare professionals was compared. The data reported to the data bank and to state licensing authorities that may not have reported any adverse actions. These specific professions were identified. We then contacted these agencies and identified the professions that were subject to the federal reporting requirements, and then we worked with you to ensure that appropriate reporting started up and continued. The second group, the Adverse Licensure Action Comparison Project, compared publicly available licensure actions published on state websites or requested from you for certain years with data currently stored in the data bank. Then we contacted you with the results of the comparison and the actions not found in the data bank. You reviewed these actions and reported actions as appropriate. These projects were updated this past July. The next update will be posted on our website in a new way, and we will provide you with those details as we move ahead today. Here is a summary of our compliance efforts with you as of this past June. This comparison project started with 6 of the top queried professions you see listed here. Then we included physicians and dentists. We then added chiropractors, physical therapists, optometrists, and the behavioral health professions. This is now the top 12 list of most queried professions. To date, we have looked at thousands of reports for these 12 professions. 967 separate reviews were done, comparing reports in the data bank to publicly available licensure action data taken from your public websites or sent to us by you. This effort has resulted in 3,700 plus new reports that have been disclosed over 4,800 times to data bank queriers. These disclosures put important information into the hands of those querying organizations to inform their decision-making. At this point in time, these professions are 96% compliant with the effort. I think you'll agree that these are great results to date. We're still working with the remaining boards to bring them into compliance, and thanks to each of you for your efforts to resolve these reporting issues. The work that we have done with the 12 professions up to this point has set the stage for a new compliance framework that the data banks will put in place moving forward. Let's move on now and talk about this new 2-part framework for compliance that we will be starting up. And to do that, I'd like to introduce my colleague, Joe Clift, to take us through the next several slides. Joe?
Thanks, Bill, and hello everybody on the line. We want to turn our attention now to our new compliance framework. As you are probably aware from what Bill has described before, our past efforts focused on the top 12 professions for 2006 through 2009. Now, we are focusing efforts on the same professions, but for 2010 through 2011 actions. Our new framework is a 2-part process. The first part is a one-to-one match, just like we did for 2006 through 2009. The difference is that we will focus on all the professions for half the states each year. Before, we did groups of professions. We will also look at support professions as well, like dental assistants and pharmacy technicians. Here is the breakdown of the states. We are focusing on the states for an April 1st, 2013 posting right now. Afterwards, we will focus on states for the October 1st, 2013 posting. The year after, we will focus on the Cycle 2 states. Note that the review period for the Cycle 2 states is 2010 through 2012 so that we can catch up. The following year, we will go back to the Cycle 1 states and review 2012 through 2013. This process will repeat, and each year we will look at the previous 2 years of data for all 12 professions. This new framework gives the states a year off between reviews, but remember, that year off doesn't mean you don't have to report. The U.S. territories will also be part of the first cycle. The second part of the framework is the attestation. For all non-top 12 professions, boards will attest that they have reported all actions to the data bank. This will happen during your entity's renewal and will be an electronic process. We will post online, just like for the top 12 professions, if you attested or not for the professions that you regulate. Examples of professions that will fall under the attestation process are massage therapists, acupuncturists, occupational therapists, speech-language pathologists, etc. So where are we today with the process? Right now, we are in the review process for the first group of states for 2010 through 2011. We have been gathering data online for those boards that publicly post disciplinary actions. For those boards that do not post online, we will be requesting data from you in early October. All data will need to be gathered and matched with missing actions reported by early March 2013 to achieve compliance status. If your board uses a reporting agent, we may work directly with them. So how do we get there? We will match the actions your board has taken to reports in the data bank. Any missing actions, called gaps, will be communicated to you via the new compliance page that we will demonstrate for you today. Your job will be to submit reports for missing reportable actions, actions that you think are not reportable. You will use the new compliance page to communicate with us by providing sufficient justification. If you have too many actions to report by the posting deadline, you may be asked to fill out a corrective action plan, which will also be an electronic process through the new compliance page. More details about the electronic corrective action plan will be provided when that feature is available. Compliance status assignment. We have 4 statuses that we use. Attest and not attest we went over before. Your board is marked compliant. That means that if your profession has been marked compliant, that means that your board has submitted a report to the data bank for all reportable actions for the time period covered. Working towards compliance means that your board has submitted some, but not all, reports. Non-compliant means that your board has not submitted any actions, your board has been unresponsive to our efforts, or your board has submitted an insufficient number of reports relative to the total number of missing reports. For example, if your board has 100 outstanding actions to report and you have submitted 1 report, you would likely be labeled as non-compliant instead of working towards compliance. Under review is reserved for specific situations, such as where the data bank has not reviewed your profession, or we are still working on a corrective action plan for your profession. Our new website allows for real-time posting of the compliance status of your profession. My colleague Margie will demonstrate our new website shortly. If your profession is compliant before April 1st, 2013, we will post your compliance status when it occurs. All other statuses will be posted on April 1st. And now, Margie will show us the new website.
Thanks, Joe. So what I'm going to do is take you guys through a quick walkthrough of our posting tables. So here on our main page, you can see under the Resources section, the Statistics and Compliance Data. So you just go ahead and click on this link, which takes you to this page with the map on it. I want to point out this link up top that says the United States. If you click on that link, it'll show you the data for all of the United States. And if you click on this link, it'll show you data by profession in terms of the compliance statuses. If you click on one of the states on top of the map, then it'll tell you compliance data and stats specific to that state. So what we're going to do is go ahead and click on Nebraska. Here on the left, you have two tabs that are the statistical data, and it gives you Nebraska-specific trend plots, and you can also see the tabular data with our research data. On the right, you have our compliance data. The first tab takes you through the background information where you can see compliance efforts, webinars, definitions. You can read through that, and the actual compliance reporting statuses. So at a glance here, you can see the professions that have been evaluated and reviewed for Nebraska and the projects that those professions were done under. If you want to know the definition of those projects, right here. My colleague Bill went over them a little bit previously. Also, it shows you the current status and first and last review. You can expand on professions, too, if there are sub-professions within them, and see also the current status and last reviewed. You can also download an Excel and CSV file that gives you all of the information for that specific state. What we can do is go to a specific profession. So here we have physicians, and it's broken down DO and MD. When I click further, you can see the history of the compliance reviews. It shows you the date of the posting, which project it was, the status, and the time period reviewed in terms of the actions. In our new effort, what's going to be fantastic about this is that whenever you become compliant, it will be posted. So previously, you had to wait for an actual posting date to get the compliance status posted. For all compliance statuses in real time, as soon as you become compliant, we're going to post it. For the rest of the statuses, as my colleague Joe mentioned previously, on the posting date, everyone will be posted. So if I go back to the main page, I want to finish out by pointing out that here in the news section, we have a link to our video that goes over the compliance page. Joe will be going over a little more in detail today, too, about that. All right, go ahead and go back. Just to review, you go to our main website, you click on the U.S. map, go to your specific state, go to reporting compliance status, and then you can view the status for any of the professions that we have already reviewed, and in the future, whatever compliance postings that we put up. So now I'm going to hand it off to my colleague, Bill.
Margie, thanks for showing us the new map and how the results are posted. Now it's going to be much easier to find and compare the results you might be looking for. Now let's move to the next piece that we wanted to show you, the new compliance page. This is a new application available on our website, on our secure website, after you log in. And as Margie mentioned, we have already posted a training video on our homepage for you to review these features whenever you want. This new application allows you to view and reconcile the missing actions that are identified directly online. And you will also be able to have back and forth communication about these missing actions with your compliance officer as questions arise. You will see that the information is presented to you according to profession type and according to where you are in the reconciliation process. Joe is going to take us through a demonstration of these new features. Go ahead, Joe.
Thanks, Bill. So at this time, we'd like to show you a brief demonstration of the new compliance page. If you are part of a compliance effort, you will receive an email notification similar to this, letting you know that you have a message from the data bank. And I'm sure that whenever you licensing boards out there get a message from the data bank, you stop what you're doing and you read the message, right? To view this message, you will need to log into your data bank account. A link is provided in the email for your convenience. So let's see what this message is about. Here's a sign-on page for the data bank. So let's sign in. And here's your entity registration confirmation page. We're going to click Continue. When there are action items for you, such as compliance actions or a compliance message, a box will appear around the compliance button. As we can see here, there are some things that warrant our attention. So let's see what's going on. Here is the new compliance page. You will notice a separate button for the compliance actions and a separate button for the compliance messages. You will also see who your assigned compliance officer is. Janet Doe does not work at the data bank. To view the message that was sent to your email, you will click on the Messages button. Here is a listing of all your messages. Don't you wish your email inbox only had 3? The newest messages are presented at the top. Let's click on the new message to see what this message is about. And here's the message that you received from your email notification. In this message, you are being informed about potential missing actions in the data bank. There is a reply button here if you want to reply to this or any message that you receive. Please note that the system will not allow you to reply back with a note that says, "Please stop bothering me." This is a complete list of the actions that the data bank believes is missing. You can click on an action directly to deal with the action, but we don't want to do that here because then we couldn't show you the compliance actions page. To see a listing of all the actions, click on the compliance actions page like I just did, and click on the compliance actions. This screen shows us all the unresolved actions. The actions in yellow have not been read. Since we're already in pretend land with practitioner names like Dixie Cup and Kaiser Roll, let's pretend that you are a composite board and you want to focus on physician actions. You can use the Filter by Profession drop-down to filter by physician. Try to say that 10 times fast. So let's click on Filter by Profession from the drop-down. And if we click Physician, now you can see that only physicians appear. If you want to organize this alphabetically, you can click on the name. As you can see, all the names are listed alphabetically. You can do the same for date, profession, and status. If you want to download this data, you can click on the Download button, and you can download this data in Excel or CSV format. But in the essence of time, we're going to skip this. So here we are with our list. We need to deal with one of these compliance actions or the data bank's going to be calling us. So let's check out Bonnie Blue. If I click on Bonnie Blue's name, here's the screen that tells us all the details about this missing action. The description, the type of action, in this case it's a denied license to practice, and the date are all presented here. All related correspondence between you and the data bank will appear here. After reading this information, you determine that yes, this is an action that should have been reported, and you are going to submit a new report for this action. So we want to click on Submit a New Report and continue. Now, we're going to start the new report. We have to type in the practitioner's name, continue, and then click State Licensure Actions, because this is a denied license to practice. Dr. Blue is a physician, an MD, and I'm going to click Continue. Remember that the compliance action indicated that it was a denial of license to practice. You looked at your records, and it was, in fact, a denial during the renewal, so that's what you'll pick. I'm going to scroll down so I can click on the Continue button to submit the report. But in the essence of time, we're not going to actually go through the whole report process. I'm sure you all are familiar with this. So we'll pretend that we have already submitted a complete report. This is showing you that you have submitted a report on the practitioner. It gives you the DCN, And because you care about timely reporting, it also lets you know that you submitted the report within the time frame required by law. And here's the report that we didn't fill out together. The main X activity is showing you the history with this missing report, when it was identified as a potential missing report, and when the report was submitted. Since we're done with that, we're going to go back to the main compliance page. Note here that Dr. Blue is no longer displayed because a missing report was submitted. Dr. Blue is now in pending. Note that this page defaults to unresolved and unfiltered. Before we had organized these alphabetically and by physician, but that's not the case anymore. If you want to see Dr. Blue, you have to click on pending. As you can see, Dr. Blue is in pending because the report is waiting for databank action. After the databank approves the report, the action will be moved to resolved. And there it is, resolved. If the databank did not approve this report, it will go back to unresolved. There would then be a note in the related correspondence about the action and why the databank did not approve the report. Since that's not the case here, we'll go back to the compliance actions page. So right now, we want to show you how to ask a question about a missing action that was sent to you. So let's view an example. Yes, right here. Paul Paulson is a good example. Let's click on that name. Here are the details about the missing action. It says it's a surrender and gives you the action date. Note that the only information the databank has is that this was a surrender. Sometimes public data will only have a small bit of information, like that a license was surrendered, but that isn't enough information to tell the whole story. And at the data bank, we want the whole story, and that's why this was a potential missing action. So you want to ask a question about this. Your records indicate that this was a voluntary surrender, and you don't believe it's reportable, but now you're not so sure. So we're going to ask a question about this. You will type in your question in the text box. If you use the Ask a Question option, you have to type something in this box. So here we type in our question. This was a voluntary surrender. Is that reportable? We're going to click Continue. Because you submitted a question on this action, it no longer shows up in unresolved because it is waiting for databank action. The action appears in pending. Let's click on Pending. Here you can see that a question was asked about this missing action by the bold text right here. Wait, what's that? Oh boy, my colleague just informed me that the databank has responded to our question. I can't wait to see what they said. Let's go back to the Compliance Actions page and check it out. Yup, it looks like they replied. Note the bold text next to Paul Paulson's name, and also note that we are in unresolved right now. Let's see what the databank had to say about our question. Oh, the anticipation is overwhelming. The response is noted in related correspondence. They give us some details about why a surrender is reportable. I'm looking at this right here. Even though you recently submitted the question, you're a busy person dealing with a lot of certification and licensing issues, and you've already forgotten what question you asked. No worries. You can use the scroll bar here to see what your original question was. You can see your original question here that it was is this a voluntary surrender? Is it reportable? Based on the databank's response, you decide that it is not reportable. After all, this practitioner was retiring and was in good standing with the board. Now we will show you how to close an action that is not reportable. Since we're already dealing with Paul, we'll continue with this guy. We will choose Close This Issue. This action is not reportable. You must enter a justification for why the issue is not reportable. You want to provide sufficient justification because this will be reviewed by the data bank. You want to state, for this case, that the practitioner was retiring and surrendered his license. So if I click inside the box, God, I typed that fast, then we'll click Continue to finish submitting this non-reportable action. Because you submitted the action as closed, not reportable, it no longer shows up in unresolved because it is waiting for data bank action. If we click on Pending, we will see the action. As we can see, it is in pending. Similar to the examples earlier, as soon as the data bank approves your action is not reportable message, it will show up in Resolved. Now we will go back to the Compliance Actions page because I'm afraid our time is almost up. Remember when we started this demonstration, the compliance page showed 12 compliance actions and 1 message? And if you don't remember, that's okay. You can just take my word for it. Because we resolved 2 actions, remember Dr. Blue and Paul Paulson? Now it shows 10 actions remain. The message, because we read it, does not appear as an alert. But don't worry, that message is still there. And now we want to sign out. And that concludes our short demonstration of the new compliance page. We believe that this new system will make resolving compliance issues much faster, more efficient, and transfer information more securely than we have in the past. As mentioned before by Margie, on the Databank's public website under News, you will find a link to a professionally produced training video of the new compliance page. But don't worry, I'm not narrating that one. And now, I will turn it over to Bill, who will wrap this up for us.
Thanks, Joe, for showing us how the compliance page works and for keeping us smiling. As you can imagine, we have developed this new set of tools with you in mind, there were many questions to answer: what to include, what not to include, how to design the pages, etc. And with any new website feature, we realize that it will take time for you to understand this application and become comfortable using it. As everyone has mentioned, we developed a video tutorial for you, and it's already posted for you to take a look at on our front page. The tutorial takes you through the use of these new features step by step and provides some other practical scenarios for you. Of course, we are also available to assist you. Our help desk staff is ready to help you with the nuts and bolts of accessing, navigating, and using these new online features. And of course, your assigned compliance officers are also available to work with you on issues related to reconciling the missing actions that have been identified and posted on the website for you. So we see this as a collaborative process with you and your staff members. We have a great team of people that are ready to work with you to make this move along as smoothly and painlessly as possible. So we look forward to working with many people that we have met through previous compliance activities, or to meeting you and working with you for the very first time. Our contact information is provided on the last 2 slides for you, so feel free to contact us by email or phone with any questions or concerns that you might have.
Thank you. And this concludes today's conference. Thank you for participating. You may disconnect at this time.